People ask me how I got involved in the wine business, and the answer is simple. I married the owner, and when I married Ben Feder, we worked together as a team and expanded it, and we've been well accepted, and happily we win lots of recognition through awards. The part that I love the most has to do with when we are making the wines. It is a physically demanding job, just dealing with cases of wine. And I knew that something was different, not only in terms of discomfort, in terms of pain, but the thing that really made me know that something was going on was that I wasn't walking as fluidly. I was aware of the fact that I wasn't standing and sitting fluidly. I thought, what's that about?
I met Mrs. Feder. She came in complaining of problems with her hip. As I remember, she had difficulty getting around, pain, discomfort in her groin, and her lifestyle was greatly altered, and she was seeking relief. Ms. Feder's condition was a result of long-term wear and tear, or we call it osteoarthritis, where the cartilage is worn down, the hip bone rubs on the hip socket, and that grinding of bone against bone creates pain and discomfort. Ms. Feder has involvement in both of her hips. So on presentation, I think that one side was worse than the other clearly. So we fixed that hip, and that was roughly a year ago. I think that she's having increased symptoms on her other side and would like to get the same type of relief on the other hip that she's had from her previous hip replacement. Would you say you're better than you were before?
Yes. The right side is wonderful, beautiful, it's great.
So why are you walking with a cane then?
Because the left side is saying, what about me? I'm in bad shape here on the left and needing some attention.
I often warn them that when we fix one hip, they may notice that one hip has been screaming, and when we remove that, they may notice that the other side was actually more problematic than they had realized.
To say that I'm looking forward to my surgery is not an exaggeration. I know it's going to be a positive experience.
The reason that I do hip replacement surgery and knee replacement surgery is I like to see patients return to activity. It's one thing to see someone who comes in who has a lot of angst, fear for the future, fear for what they're going to do as they found themselves declining and in pain. And it's very rewarding, both for me as the physician and for the patient, to see that this is not the end, but the beginning of another journey as they return to normal activities. That's very fulfilling.